I'm really pleased to introduce the first speaker for this afternoon session. I'm really looking forward to her talk. This is Maureen Daniels, who's the coordinator at the Gerry and Nancy Pencer Brain Tumour Centre in Toronto, Canada. Very pleased to have her here. She will talk about a bouquet of supportive care, 20 years of evolution learned and looking ahead. Thanks very much, Maureen.
Thanks, Maureen. I hope everybody can hear me. I just like to say thank you so much for the invitation. I was so excited and pleased to be able to share our Toronto experience with everybody in Australia today. I would say good afternoon, but for me here it's good evening. And I guess I'm talking to you from the past, not to you in the future. So I am eager to share our experience with you. I'll give a little bit more of an explanation about the title of my talk in just a few minutes, but if we could just go to the next slide, please. When I was asked to give this talk, I was asked to really focus on supportive care, and so I thought I perhaps would provide a definition for supportive care that I think really sort of encompasses what we have been striving to do in terms of our model of care at the Pencer Centre. And this definition from the National Cancer Institute seemed to really sum it up in a good way for me. So moving on from there, if I could have the next slide. I'd like to introduce you to Gerry Pencer, who is the hero in our story. Gerry was a very successful Canadian businessman and the CEO of a private label soft drink company, Cott Beverages. He was very successful, I think outside the box kind of guy, and we like to say he was a very effervescent man. But in 1997, at the age of 52, Gerry was diagnosed with a glioblastoma. And he was extraordinary in many ways. The one way that he was completely ordinary was that he lived about a year with his glioblastoma. But in that year, if I could have the next slide, he and his family took on a task to transform the way patients are treated with brain tumors in Toronto specifically, but I think hopefully it's had a broader impact. Gerry was, as I said, I think outside the box kind of guy, and during the time early on in his diagnosis, he and his family looked to educate themselves about his illness and to look for supports and resources, and discovered quite quickly that the system was very fractured. It was hard to access some types of services, and it was very piecemeal. So you had to go one place to get one type of support and someplace quite different for something else. And so if I could have the next slide, out of that sort of frustration was born a really wonderful partnership. The Pencer family made a sizable donation to the Princess Margaret Hospital, and with working in conjunction with the Gerry and Nancy Pencer Brain Trust and the Princess Margaret, we saw the establishment of the Gerry and Nancy Pencer Brain Tumour Centre, which has a goal to provide comprehensive care in one location. And so I'm just going to quickly sort of share with you some photographs of our place. We are very fortunate to have a lovely environment. And just to circle back to the title of my talk, Mrs. Pencer remains very involved in our center, and while a lot of things are paused by COVID, prior to COVID, she made sure that we have about a half a dozen beautiful bouquets in our center of fresh flowers every week, so that our space is really meant to try and ease anxiety for patients and families, and make it a place where patients and families know they can come to seek professional support for education, and also as a quiet respite in the middle of a very tumultuous time for them. So I recall very clearly when our center opened, and it was a very innovative approach to patient space in the hospital, and quickly people started calling it the Palace and the Penthouse. We were on the top floor of the hospital as well, and my response to that was always, if you shouldn't feel like you should have a nice place to sit when you've been newly diagnosed with a brain tumor, I don't know when you do deserve a nice place to sit. So our physical space is really meant to be as much a part of the supportive care model that we practice as the other things that I'm going to talk to you about today. So if I could have the next slide. We are very fortunate to have a very large multidisciplinary team at our center, and this is a pretty good portion. It's not the whole team, but a pretty good portion. That picture was taken maybe 3 years ago. If I could have the next slide. This is what we look like today, but we are still a very collegial and dedicated group, and so we are working within the confines that COVID puts us in, but we are eager to get back to looking like the first slide for sure. If I could have the next slide. This is the sort of linchpin of our treatment model. This is our medical team. We are very fortunate, I'm sure, for people who have joined us today. There's some names on the list who are familiar to people in the international brain tumor community. Dr. Mason is our medical director and our neuro-oncologist, and we have 4 amazing radiation oncologists who see our patients every week as well. Dr. Norm LaPerriere, Dr. Barbara Ann Miller, Dr. David Schultz, and Dr. Derek Sang. So we are very fortunate in the medical support that we have in our center. If I could have the next slide, please. This is what our sort of weekly clinics look like. We have 9 primary CNS clinics a week. We see approximately 125 primary brain tumor patients each week, all at various stages of treatment, from newly diagnosed patients to patients who are at end of life. And of that 125 patients, between 10 and 12 are people who we are seeing for the first time in a given week. If I could have the next slide, please. This is sort of a brief overview of who our staff are, and I'm really eager to share with you the roles that these team members play, and the individuals who fill those roles, because there are some pretty remarkable people in that group. And if I could have the next slide, one of the sort of hallmarks of our model is we do meet weekly as a team on Fridays each week. The purpose of our getting together is to review all of our patients, all of the new patients we've seen each week, and to update each other on other patients with acute or ongoing issues. And really the benefit of this is that it puts us all on the same page about how our patients are doing. And the other ripple benefit of all of that is that we certainly learn a lot from each other each week. Everybody shares their expertise, and that's great. And it's really just nice for all of us to be together in the same room. It really fosters wonderful collegiality, and so that's a big bonus. Next slide, please. We are also, as Dr. Ko mentioned, a teaching center, and we certainly benefit greatly from the dynamic energy of our medical trainees, medical students, residents, fellows, and also a variety of students from all of the allied health disciplines. Many of the people on our team are regularly mentoring other trainees in their area of expertise. And so we're very fortunate to have all of that youthful energy and knowledge to add to our center as well. So I'd like to just tell you now a little bit about some of the people who do the work that that we do every week, and really how they fit into our model of supportive care. We have a wonderful administrative assistant, Sonia Silva, who is really the glue who keeps our center moving. Sonia is familiar with many of the patients, and they with her, and they certainly know who to call if they need to get action. And she is a master at streamlining tests and appointments for our patients. And she also really keeps the administrative side of our practice running very smoothly and efficiently. Next slide, please. Cheryl Cantor is our social worker, and she has been our social worker for the last 20 years. And the social work position in our center is really an excellent sort of example of our private-public partnership. Prior to the opening of our center, our CNS site was allocated a half-time social worker. So, so that meant somebody was available to our patients sort of half-time. And in collaboration with the added resources provided by the Pencer family, that social work position was expanded to be a full-time position. So now we have a full-time social worker, Cheryl, who works in our site. She has a great deal of expertise in patient and family counseling and is very able to see patients in a timely way. She also has a wealth of knowledge about financial supports and guidance about how to access those kinds of things. And she's a very one of the very experienced facilitators of our caregiver support group. So we're very fortunate to not only have this full-time position, but also to have such a capable person in that role. Next slide, please. We are also very fortunate to have the full-time resources of Dr. Kim Edelstein, who is our neuropsychologist. Kim's role is really two-pronged. She has a very active clinical portion of her practice where she will see our patients for comprehensive neurocognitive assessments, particularly patients who are contemplating returning to work or school. Sometimes family members are eager to have a neuropsych assessment for patients. So Kim provides that service to our patients at no cost to them. And she also has a very dynamic research component to her role, studying a variety of strategies for improving coping with neurocognitive impairments, and also looking at ways to improve quality of life for our patients. She also is able to provide a lot of expertise, both to other members of our care team and to people in the community. Oftentimes a full-blown neuropsychological assessment is difficult to undertake for some patients. And Kim's just also very available to provide expertise on how to help patients cope in the situation where a neuropsych exam is not always the best option. Kim also is a very experienced facilitator of our caregiver support group. So we're fortunate to have that expertise as well. Next slide. We also have the very unique position, and I'm going to come back and talk about this position a little bit more shortly, but we have a rehabilitation consultant on our team. This is Kristin Collins. Kristin is an occupational therapist by training, and she is on our team to provide assessment of functional status for patients, provide assistance about assistive aids, provide education for things like energy conservation, fatigue management, and also a very capable facilitator for a caregiver group. She also runs a weekly relaxation therapy program for our patients and family members. This role has also been really instrumental in helping us to develop a lot of educational materials for patients and caregivers. And one of the really beneficial things about this role as well is that it provides a great resource for rehabilitation supports in the community. Many of our patients get referred for rehabilitation support, such as OT or physio in the community. And they are seen by people who don't have a lot of experience in treating patients with brain tumors. So Kristin is available to liaise with those people in the community to provide additional education and support to help manage that. Of course, I'm a nurse by background myself, so I want to certainly acknowledge the contribution of our clinic nurses, who are really the boots on the ground in our clinics, and they provide hands-on education. Mary Jane and Dolores in this picture have many years of experience in helping patients manage their chemotherapy and symptoms and side effects associated with both their disease and their treatment, and are also an excellent resource for helping to connect people with community supports. Next slide. We also have not solely allocated to our center, but certainly within Princess Margaret, a very big outpatient pharmacy, and our pharmacists are really expert at helping to dispense medications to our patients with additional education, and also things as simple as dispensing the medications in ways that makes it easy to understand and for patients to be able to take their medication properly. And of course, they also provide a lot of education just around general medication questions and drug interactions. Next slide, please. We also have a dietitian. I don't have a photograph because our dietitian, who was with our team for the last 20 plus years, just retired, and we have a new dietitian who's joined us. But of course, for many of our patients, there are a lot of nutritional concerns specific to their treatment. Certainly, patients who are on chemotherapy have a lot of concerns about their nutrition. Any patients who are taking dexamethasone for any period of time often have nutritional questions and challenges. And so our dietitian has a lot of experience with helping people manage those kinds of questions. And again, once again, to provide general information about proper diets, cancer diets, and also general nutrition questions. Next slide. We also have a very vibrant clinical trials department, and typically have a number of clinical trials going on. And our two clinical trials coordinators, Stephanie and Anyi, are really the linchpin there, responsible for enrolling patients and the ongoing monitoring of patients on any study. And really, they become the main point of contact for patients who are enrolled in studies. There's a lot of meticulous work that goes along with being involved in a clinical trial, and they're really an amazingly knowledgeable resource and guides for patients who are willing to be part of a trial. Next slide. I really want to highlight our radiation therapists because in my view, in many ways, they're sort of the unsung heroes of patients who are just embarking on brain tumor treatment. The radiation therapists are the people who really deliver the treatment every day to patients, particularly our glioblastoma patients who are, most of the time starting on a very intensive period of radiation therapy. And the radiation therapists are the people who see those patients on a daily basis for 6 weeks at a time. So they have a great deal of expertise and education to help patients through this very tumultuous period of their treatment, and are also excellent resources for referring patients to other supportive care services as required. So we're fortunate that we have a really dedicated, dynamic group of therapists at our center as well. Beyond that, over the last 20 odd years, we have tried to develop a supportive care program that provides services that are helpful and in some ways unique to our patient population. Certainly pre-COVID, and I'm going to come back to COVID again too, but we offered monthly in-person support groups for both our patients and caregivers. Groups run separately, but at the same time in our center. We have offered weekly relaxation therapy for patients, art therapy programs. We do a celebration of life for patients who have passed. And over the years, we've run a number of workshops specifically to try and address the needs of our caregivers. Next slide, please. I think one of the really beneficial aspects of our model is that for the most part, we are all housed in the same location, and that has really fostered a lot of collaboration for projects that would otherwise have been very difficult. So over the years, we have developed a number of resources for patients, and this is sort of a partial list that you see in front of you, but certainly the opportunity to be in close proximity with colleagues on a regular basis has really fostered a lot of beneficial educational and informational initiatives. Next slide. I also really want to sing the praises of our Patient and Family Advisory Committee. And once again, that's us on the left a couple years ago. That's us on the right a couple months ago. So this is a group of patients that when I think of them, next slide, please. This is the thought that always comes into my mind. Our Patient and Family Advisory Committee is a group of patients and families, volunteers, along with some clinic staff. Next slide, please. Who came together as a group at Gerry Pencer's sort of guidance to bring together patients and families to have significant input into both the design of the Pencer Center, not just the physical design, but also to the programs and materials we provide. And so since June of 1998, we meet every month, and it's a way for us at the Pencer Center to have a patient voice to help guide what we do. They're very good at telling us what we do well, and they're even better at telling us what we can do better. So it's a very valuable resource to us. Next slide, please. I think one of the most proud accomplishments of our center, of our Patient and Family Advisory Committee, is about 10 years ago, they thought that they would like to establish a research grant award, and we've named it the Adam Cools Research Grant. Adam was a member of our Patient and Family Advisory Committee for many years, a young man who passed far too soon, and so we are very proud to offer this grant in his name annually. And in the last 10 years, our Patient and Family Advisory Committee have awarded almost $750,000 in research funding to brain tumor specific projects within university health networks. So I think that's probably one of the most proud accomplishments of the group. Next slide, please.
Just another minute, Maureen.
Okay, I'm just gonna finish up quickly then. I will tell you that they have provided us with a lot of other beneficial incentives as well. Next slide. I'm just gonna pop through, and they also provide 100% of the support for our rehabilitation consultant. This position would not exist at all within our center if they were not there. I'm just going to get you to forward, Dennis, through a number of slides. The answer to how we provide that support is they do an annual fundraising run. And we're closing in on $3 million raised in the last 20 years. I will get you to forward through the next couple of slides, Dennis, and I'll finish up just very quickly, Marina. We have in the past, a number of years ago, did an evaluation survey of our services, and I'll get you to advance the slide again, Dennis. I won't go through all of the details, but essentially the key findings of the study was that patients feel that the programs we offered have allowed them to take a more active role in their healthcare and help them to make more educated decisions, which was really great. We were very gratified to hear that. But I'll get you to fast forward through a little further, Dennis. But I think that I'll get you to stop there for a minute. We are in the, as the pandemic hit, we were in a place where we were starting to look at refreshing our patient input. And so COVID has certainly impacted how we provide our care. I'll get you to just go to the next slide, please, Dennis. And next. And so COVID has certainly swung the pendulum in a different direction from when we first opened our center. And I think that if you'll go to the next slide, this analogy sort of really struck me when I was thinking about how we go forward from here. Many things have changed with COVID. And so as hopefully we see COVID behind us, I think that we can go to the next slide. What we will endeavor to do going forward is to get some updated post-COVID patient and caregiver input. We probably need to do a new survey of what supportive care services will look like and what they would be beneficial, how patients, how we can address best patients' need for support and care in a way that's easily accessible to them. I guess I probably should just speak for myself, but I know virtual care has become a real pillar of COVID necessity. But as a healthcare provider myself, I know I didn't become a healthcare provider so that I could spend all my time talking to patients on a computer. I think there is real value in in-person care and relationships. And so I'm actually looking forward to hearing Professor Drummond's talk on online support and hearing how we can make that part of a valuable patient support going forward. Next slide, please, Dennis. So I'll finish there. I think I've probably taken more time than I was allotted, Marina, but thank you for indulging me, and I'm very grateful for the chance to share our center with you today.
Thanks very much. I think that your talk just really highlights the need for a multidisciplinary approach. It's really important with this patient group.